Hello, and welcome to the second episode of 2026 for the Harvard Extension School Psychology Student Club podcast. We have with us today Dr. Alison Warren. She is an instructor at Harvard Extension School and an adjunct assistant professor at George Washington University School of Medicine and Health Sciences in the departments of Integrative Medicine, Clinical Research and Leadership, and Institute for Brain Health and Dementia. She is also currently undertaking her second doctoral degree in translational health science. Her background includes traditional Chinese medicine, integrative and lifestyle medicine, nutrition, neuroscience, and psychology. As a clinical researcher, her work examines the relationship between these disciplines as they relate to the chronic stress response and brain health, as well as stigma related to medical pathologies such as mental health disorders and dementia. And she is well published in these areas. Thank you again, Dr. Warren, for joining us. To begin, I'd like to ask you how you would define loneliness.
Well, loneliness is the distress we feel when there is a gap between the relationships we want and relationships we actually have. So it's not necessarily about how many people are around you. It's about whether you feel meaningfully connected.
Thank you. Are there different types of loneliness?
There may be many different types of loneliness. I think the major buckets of loneliness include emotional loneliness, which is the absence of a close, intimate bond, like a partner or a best friend, for example. There is what's called social loneliness, which is kind of more lacking a broader social network or social circle and the sense of belonging or community that goes along with it. And then the last big bucket of loneliness is what we call existential loneliness. And this is a deeper feeling of being fundamentally alone or unseen. And this is something that we think of as rooted in the human condition, right? It often occurs when we start to confront our mortality, for example. We're born alone, we die alone. And someone can have one type of loneliness without the others or a combination thereof.
Okay, thank you. I want to ask a follow-up for that question. So you spoke about loneliness in terms of friendships and romantic relationships. For people who don't end up in romantic relationships, are friendships able to kind of replace that need? And are people able to fulfill their need for connection without romantic relationships?
It's a really great question. And I think it's highly dependent upon the individual. For some, they, especially those who have preconceived notions that they should be in a romantic relationship, I think that can be very difficult and may or may not end up in loneliness. But what we know is you can be surrounded by people and feel very alone, or you can be alone and not feel lonely at all. So there are a lot of different contextual factors that go into that. I have personally known a lot of people who do not end up getting married, and they have a wonderful social network with very close family and friends, and they don't seem to be suffering from loneliness. So I think it just depends.
Yeah. Thank you. Yeah, I definitely value friendship a lot, so I wanted to ask that.
It matters, right?
Yeah, no, friendships are very important for me. So can you differentiate between loneliness and isolation?
Yes, and that kind of piggybacks on what we were just talking about. So isolation is a little bit more objective. Social isolation involves how many contacts you have, whether you live alone, how often you interact socially. So this is a lack of social contact or infrequent social contact. Loneliness, on the other hand, is a little bit more subjective. So this is how you feel about your level of connection. And loneliness, importantly, involves this, frankly, distressing feeling when there is a mismatch between the quantity and or quality of the relationships you have and the quantity and or quality of the relationships you would like to have, right? And again, as I just mentioned, you can be alone and not lonely at all. And you can be surrounded by people and feel profoundly lonely. But when you think of isolation versus loneliness, one is a little bit more objective. Think physically alone. Who's that movie Castaway, right? Versus the distressing feeling that arises from that loneliness. Does that make sense? Did I make sense?
That makes sense. So there are some people who can deal with certain amounts of isolation. I guess introverts would be able to handle that much more effectively.
Perhaps. And, we have, when I say social isolation, you can think of that as a little bit more objectively physically alone. That may or may not co-occur with loneliness, maybe depending on the chronicity of it, right? And yes, some introverts, for example, I'm an off-the-charts introvert. I don't need a huge social circle. I need, one or two really meaningful friends, contacts to me, and that is more than enough for me. Others feel very differently. So again, it's individual.
Yeah, I can very much relate. So that brings me to my next question. On an individual level, what determines how susceptible a person is to loneliness?
Oh, that's a good question. Susceptibility, I think, would depend on several different factors. If we go back to our childhood, there are differences in, for example, early attachment styles. So, for example, if a child had an insecure attachment or an anxious or avoidant type of attachment, this might predispose an individual to a greater vulnerability to loneliness, versus when you're a child and you have very secure attachment, that tends to foster more resilience and social skills and healthier relationships. But there are a lot of other factors, like if you have social anxiety, if you suffer from depression, especially, when we're depressed, we tend to kind of go into turtle mode and recede into ourselves, which can become lonely. Life transitions are a big individual factor. So when you move, when you are starting college, starting a new job, if you have a divorce, if you lose a spouse or a family member. So those major life transitions can certainly create more vulnerability. And people with chronic illnesses, for example, whether psychological or physical, can be more susceptible to becoming lonely. So there are a lot of different factors. And you mentioned even temperaments and personality types, right? Some people need more connection or contacts to feel regulated and secure, whereas others need less.
Right. Thank you. So is it normal to feel lonely? And at what point does that loneliness become abnormal?
Loneliness is absolutely normal. It's, think of it as an adaptive signal, like hunger or thirst. It's a signal that's telling us that we are lacking a basic need. In this case, the need for connection. So transient loneliness happens to all of us, right? It becomes really concerning when it becomes chronic or becomes intensely distressing and becomes associated with things like withdrawal, with depression, with decline in your health. So the problem isn't necessarily feeling lonely per se, it's staying lonely, if that makes sense.
Yeah, that makes a lot of sense. Could you describe the loneliness epidemic? I've been hearing a lot about that.
Yes. So in 2023, our U.S. Surgeon General, Vivek Murthy, declared loneliness an epidemic in the United States. It is actually an epidemic in the entire world. But it refers to this rising prevalence of chronic loneliness across all age groups, and growing evidence. There's growing evidence that it affects our physical health, our mental health, and even our mortality risks that are comparable to major medical risk factors. So it's not just a feeling problem individually. This is a major public health issue.
Do you think that as a society, this loneliness is likely to increase or decrease, or I guess stabilize?
I think without structural change, there's a good chance that it will increase. We've seen, of course, COVID brought this to light, especially, but we've seen declines in community participation. We've seen rising digital substitution for in-person interactions. We see more people living alone. So I would say that loneliness is not inevitable. It does reflect how we've structured our modern lives. But the good news is that a lot of researchers beyond myself are really trying to tackle this problem and see how we can improve loneliness, not only in the United States, but across the world.
Could you speak about some ways that we can combat the loneliness epidemic and loneliness in general?
Yes. So with regard to the epidemic, I think one thing that would be really helpful is if we start normalizing it, start normalizing talking about loneliness, because like so many distressing feelings and other mental health conditions, loneliness can involve stigma and it can involve shame. You know, we get a lot of people, especially I've seen in patient care, they're embarrassed to admit that they're lonely. They're embarrassed to sit at a restaurant alone and eat. They're ashamed to say, you know, I'm estranged from my family and things like that. So I think normalizing it is a really big first step. And in a perfect world, to me, we would start building connection and education into healthcare, into medical schools, into psychology programs, which thank God Harvard is. And we can start strengthening community institutions and think thoughtfully about how we design spaces like campuses, right? That promote opportunities for interaction. And I think, I know I go on rants on this, but I think also another really good idea is to promote intergenerational connection, which would be really, really helpful for all generations, but especially older persons. But at the end of the day, to combat the loneliness epidemic, loneliness isn't solved by simply telling people to try harder, to go out and make new friends, to try harder and go get a dog, right? It requires more systemic shifts, I think.
I really like the idea of intergenerational socialization and to combat loneliness. My grandma is one of the most important people in my life. I think that's been an incredibly important relationship for both of us, especially when she was widowed. So yeah, I appreciate
so happy about that. I'm so happy to hear that. And you know, on one hand, we have the older generation who they've had losses, they've lost spouses, they're going through these transitions, they most likely have a lot of health concerns, and they get lonely. But then there's been a rise in adolescent and younger adult loneliness as well. And I think being able to bring the generations together, you can learn so much from each other and create these meaningful bonds. So I'm so happy you said that.
Yeah, it's a huge part of my life. And I love talking to my grandmother's friends and learning about their experiences in life and seeing how things have changed. Another question inspired by my grandmother is when my grandfather died, we did get her a cat that she loves. And you said that pets don't necessarily fix it, but I'm wondering how pets contribute to loneliness and the health factors, the risk factors related to it.
Yes. And let me be clear. What I was trying to say is it's not as simple as telling someone to go get a dog, right? I happen to be a huge animal lover. I have 2 big dogs. And first of all, there was a big meta-analysis about what works and what doesn't for reducing loneliness, and particularly for the older generation and those who were living in long-term institutions. Animals had the highest effect size of any other intervention. So I think there's such a special bond with an animal, especially when it's unconditional love, right? And it also gives you purpose, meaning and purpose to take care of another being. And I will share with you that during very hard times, I don't know what I would do without my dogs. They have gotten me through the worst of times when I felt lonely. So I think it is so powerful. And I would, as long as you are willing and able to have a pet, I say go for it.
I completely agree. My pets have been a huge part of my life, and my cat is listening to us right now.
Oh, so nice.
Yeah. I'd like you to speak about certain groups that might be more prone to loneliness.
Sure. So we know that kind of in general, loneliness tends to have a U-shaped distribution, meaning there are two peaks in that U, right? So there tend to be peaks in adolescence and tend to be peaks in older age. The caveat is all age groups, all sexes and genders, all people of all socioeconomic statuses suffer from loneliness at some point in their life. Younger adults and older adults tend to have those peaks right now, is what we're seeing. But also people with chronic illnesses are definitely more prone to loneliness. Caregivers, those who are experiencing major life transitions, like we talked about, getting married, getting divorced, having a health issue, losing a spouse, etc. And individuals who feel marginalized or stigmatized. For example, if you are dealing with the stigma of a mental health disorder, which is a huge problem right now, you tend to kind of isolate rather than reach out. So stigma, any type of stigma, whether it's mental health disorders, dementia, etc., tends to delay help-seeking behaviors. We don't talk about it. So you withdraw and can become more lonely. And interestingly, there's a major rise in adolescent loneliness right now. And we can't blame social media entirely, right? But there's a really concerning rise in adolescence, especially.
Are there things we can do to, I know the way that children are being educated at this point, children are just on screens a lot more. Are there changes we can make to the educational system to kind of reverse that?
To reverse being on screen?
Or just to reverse the loneliness that's increasing in adolescence?
Well, I think about our program at the Extension School, and there are some classes where, and I've always tried to do this, but there's some classes where they give you more opportunities to interact with your peers, rather than simply giving a lecture and then signing off, right? I think creating more spaces for those opportunities to interact, even digitally, I think is really, really important. And I think when teachers and professors lead that, it can be a lot more helpful than telling your group to just, make a WhatsApp group and you're done, right? So I think when we can integrate social connection into teaching, I think that's a major a road to success, for as well as you can do online, right? I don't think there's ever a substitution for in-person, but I think those are ways to really mitigate it and create more opportunities.
Based on my Harvard Extension School experience, that's definitely been the case. The classes where we're encouraged to socialize and build relationships, those are the ones that have really changed me.
I'm so happy to hear that. Good.
So in your research, you study older women and cognitive decline in older women as it relates to loneliness. Could you address that further?
So this is still emerging research, but we, including me, think that older women are particularly vulnerable to loneliness and a relationship with cognitive decline. And the reasons are layered. Women tend to live longer than men, which increases the likelihood of widowhood, increases the likelihood of living alone. Women are also more likely to be caregivers across the lifespan. And caregiving can shrink your social networks over time. And later in life, when those caregiving roles end, some women also may experience role loss, right? So, no longer being a caregiver, no longer being a wife, no longer being a mother, et cetera, et cetera. And relational contraction simultaneously. And there's evidence that social connection is very protective for brain health, especially for things like executive function and memory. And there is also a lot of emerging evidence that chronic loneliness, conversely, can contribute to cognitive decline, especially through stress-related biological mechanisms, reduced cognitive stimulation, especially in older women, increased depressive symptoms, and recall both depression and loneliness are risk factors for dementia. And depression is at least twice more likely in women.
Okay.
So I guess importantly, it's not something that women are more lonely. It's that there are all these structural and life course factors that shape this vulnerability. Not to mention hormonal transitions, which is probably a completely different podcast.
Yeah, so there are a lot of factors contributing to it.
Definitely.
It's unfortunate that living longer is such a risk factor.
Well, it doesn't have to be, though, right? I mean, for example, I'm thinking of my aunt right now. She is such a social butterfly, and she is, she's, I think she's almost 80 now, maybe a little bit less. And that woman is out dancing on the weekend. She is having lunch with her friends all the time. I mean, she has such a strong social network, and she's not married, and she lives in Chicago. And I mean, she is anything but. Yeah. And I think that it's so aspirational to see how she leans into her network, and it improves her quality of life so much. So it living longer does not mean we can't still live well.
Yes. No, I completely see that with my grandmother. As she continues to live, I see her lose friends, but she's a social butterfly. And I think she's 88. And I think that's part of what has kept her alive beyond widowhood.
I think there's a lot of truth to that. I'm going to meet your grandmother. She sounds amazing.
Well, I'm biased, but she's pretty awesome. Yeah. So you mentioned COVID earlier. How did COVID change patterns in loneliness?
Oh, that's a biggie right there. So first of all, loneliness has always been a problem since the dawn of time. But COVID really intensified loneliness for so many people. And it really brought to the forefront, I think, of everyone's mind what loneliness can do. Because even persons who were not particularly vulnerable or didn't think they were vulnerable suffered the effects of isolation and loneliness. And especially those who were already living alone or already vulnerable. And I think it really, really revealed how essential connection is and how meaningful it is to our health and well-being. During COVID, some people deepened their relationships even as broader networks shrank. Others were not so fortunate to do so. So COVID, like ever, changed a lot, but it really brought loneliness, I think, to the forefront of the world.
Given that COVID brought loneliness to the forefront of the world, you were speaking about stigma earlier, and I'm wondering if, as loneliness became so prevalent during COVID, if that helped to combat the stigma at all. Given
it did.
It did?
I really think it did, because, it's still a problem. It is still, and I see it still so prevalently today as being something that is embarrassing or shameful. But I guess if we could find a silver lining to COVID, I think that it normalized it just a little bit, because we were all sharing this shared experience of being isolated and what it did to us, and how detrimental it was to individuals, but also our families. And I think that researchers and clinicians, and maybe in public health, officials and teachers especially started taking it more seriously. And I'm grateful for that.
Thank you. Given that loneliness is at times inevitable, how do you suggest we cope with this feeling?
Well, one is look inward and kind of know yourself. I think we need to know what works for us and what doesn't. Okay. But I think it'd also be really helpful that we start talking about, name it without shame, admit that you're loneliness, reach out. And I think when we interpret loneliness as a signal, not a verdict about one's worth, it can go a long way. And I would say, we need to take small risks. Reach out. Join something. Show up consistently, right? So connections often grow through repetition, not necessarily intensity.
Yeah, that's important to remember. So how did you become interested in studying loneliness?
Well, I became interested kind of cumulatively over time. I became interested when I saw how often loneliness was present in clinical settings. And it's heartbreaking, when a patient comes in who doesn't have a ride home, or they're having a big medical procedure and they don't have any family with them. But I also became interested because I saw its impact on my own family members during various types of illnesses and during COVID. And I saw it just pervade the lives of so many people, but it was rarely named and it was rarely addressed. Patients, they would describe pain and fatigue, anxiety, but underneath, and in my students too, they would come to me and talk to me about all these things they were struggling with, but underneath was this disconnection, the social disconnection. So for me, it's so important because loneliness is deeply human, but also deeply misunderstood and overlooked.
Thank you. Yeah, it is a very important topic. I'm so grateful to have you here.
I'm so grateful to be here.
What is something surprising that I or our listeners probably don't know about loneliness?
Something surprising. Let's see. Well, loneliness affects your brain. Literally, physiologically affects your brain, and it affects how we perceive the world. So, for example, when you have chronic loneliness, it increases threat vigilance. So lonely individuals will become more sensitive to social rejection and negative cues. And then this can create this really vicious feedback loop, such that loneliness makes social connection feel even riskier, which then increases withdrawal. And then the cycle of loneliness and negative cognitive appraisals and isolation kind of tends to spiral. And loneliness also leads to chronic stress. And if you've ever taken a class with me, you can't not talk about chronic stress and what it does to the body. So if you didn't know that, now you know.
So I was just going to ask, why can loneliness be dangerous? And I'm going to ask about the emotional, physical, and social impacts of it. So if you could mention chronic stress, that would be great. I know chronic stress leads to many physical ailments.
Oh gosh, chronic stress leads to physical and psychological illness. So emotionally, it can lead to things like depression, anxiety, feelings of hopelessness, even suicidality. So you said emotional, physical, and social. So physically, it can be dangerous because it leads to higher inflammation. Higher inflammation ultimately can weaken our immune system. It can lead to higher risk of cardiovascular disease, neurodegenerative diseases, diabetes, high blood pressure, poor sleep. And of course, poor sleep increases risk for a whole myriad of disorders. And then socially, it's dangerous because then we withdraw and we then experience reduced trust in others that weakens our social networks. Because loneliness changes how we interpret social information. And there's this other category that we haven't talked about yet, that is when we're lonely, it changes our behavior. So, for example, we might eat more than usual. We might drink more alcohol or use substances. We might exercise less. We might eat more sugar and ice cream than we should. There's nothing wrong with ice cream, by the way, just not in excess. So it's dangerous to us physically and emotionally and socially, but it also affects how we behave in our world. So those changes in behaviors that are maladaptive then increase inflammation in our body that just continues to exacerbate, right, the stress response and how we feel physically and how we feel mentally.
It's really cyclical.
It is, yeah.
Could you discuss the connection between loneliness and development of mental health conditions?
Yes. So it's there's a lot of information. Be mindful about what I choose to talk about because I know we have limited time. But loneliness increases, number one, it increases pro-inflammatory markers. You've probably heard things like TNF-alpha, CRP, interleukin-6, those kind of things. This contributes to inflammation in our entire body. When it gets to the brain, inflammation in the brain can affect how we perceive the world. It can lead to things like depression. It can lead to anxiety. It can lead to reactivity in brain areas that process threat, right? But also when you have a mental health disorder, for example, schizophrenia, depression, anxiety, bipolar disorder, you tend to not want to talk about your illness. You tend to withdraw, which creates more loneliness, or you feel like others don't understand what you're going through. And that increases loneliness. And then you don't reach out for help, which increases loneliness. So it's not necessarily, you can't say that loneliness causes mental health disorders, but it can create an environment that leads to chronic stress that can trigger a mental health disorder, or vice versa. When you have a mental health disorder, it can increase your feelings of loneliness because of that, which then increases your chronic stress response. Right. So again, we're seeing these really vicious cycles.
And it sounds like shame is a huge part of it.
To me, I think it is. I really do, which is why I want to help decrease the stigma with anything, whether it's there's a lot of stigma around dementia. There's a lot of stigma around mental health disorders, and there's a stigma around loneliness. And I think, especially for people in the field of psychology, is it coming upon us to bring it to light, to talk about it, to normalize it.
I completely agree. Yeah, many people deal with mental illness and or they suffer from it, and then I guess they don't end up dealing with it and coping with it because it brings up so much shame.
It does. And I think we're doing maybe a little bit better. I mean, when I think about my students, long ago, you would never, ever admit that you had ADHD or that you had depression, right? You were afraid you would be treated differently. Now we're doing a much better job at helping to facilitate and support students when they have a mental health disorder to say, please tell us, please. That way we can accommodate. That didn't really exist very well in the past, I think. So I think that we're making little changes to try to help that.
I completely agree. Especially in psychology classrooms, I think it's really important for people to be able to discuss these things and bring their experience into the classroom.
Mm-hmm.
Yeah. So you've definitely touched on this already, but could you just discuss like the dangers of loneliness? And also you wrote a paper as loneliness is the driver of allostatic load and mechanisms linking social disconnection to physiological dysregulation and health disparities. So if you could just discuss the dangers addressed in that paper, that would be
great. Sure. Well, so loneliness increases what we call allostatic load. And if you haven't heard that term before, allostasis is the process of achieving stability through change. So it promotes homeostasis. You've probably heard the word homeostasis. That is, homeostasis, it basically means balance. So our bodies are constantly trying to achieve balance, whether it's our blood pH or our thyroid levels or our temperature. We want it to be in that nice, happy medium. Okay, so when it goes out of bounds in either direction, our body's going to push us to go back towards the center. Okay. When we are under chronic stress, that can lead to what we call allostatic load, which is the cumulative wear and tear on the body from overactivation of the stress response. So, like I said, that increases inflammation in your body. It leads to poor sleep, fragmented sleep, reduced physical activity, higher blood pressure. It can lead to insulin resistance, for example. So when loneliness acts as this chronic social stressor, the stress response system is activated repeatedly without adequate buffering or recovery. And so the body accumulates this physiological wear and tear. This wear and tear can go anywhere in the body. It can go to our heart. It can go to our immune system, our metabolic system, and our brain. So this is a way that social disconnection and loneliness literally get under the skin and into our bodies. I think so. Sky's the limit, unfortunately, when it comes to chronic stressors. So those were a lot of physical things that I mentioned, but also, again, it can lead to mental health disorders as well.
So as those things build up, I'm wondering how it kind of plays out throughout the lifespan. You've mentioned that loneliness is higher in older individuals, and you've also said that loneliness can be a risk factor for dementia. So I'm curious to hear more about the relationship between, I guess, dementia and old age and loneliness.
Well, across the lifespan, when you're younger and you have your immune system hasn't quite taken all the beatings as you have in older age, you might see more subtle immune shifts, for example, or more things like anxiety or another mental health disorder. In midlife, that chronicity starts to accumulate and that chronic stress starts to accumulate. So you might have more cardiometabolic risk accumulation with things like high blood pressure and diabetes and sometimes obesity from overeating and things like that. And then in older age, that chronic inflammation can result in neuroinflammation, so inflammation in your central nervous system, which can affect your neurons. It can affect your gray matter volume in your brain. It can lead to things like frailty over time. So it's the Lancet came out in, I want to say 2023, the Lancet Commission included loneliness and social isolation as one of the 14 modifiable risk factors for dementia because of what we're learning about how it affects these brain pathways and can contribute to neurodegeneration, which leads to cognitive decline, which is part of dementia, right? So you can start with mild cognitive impairment, which may or may not proceed to dementia, and they're all different types of dementia. Alzheimer's disease is one of the most common forms of dementia. Concomitantly, when a person is experiencing cognitive decline, again, they tend to hide their diagnosis and be ashamed of it, which can create more loneliness.
Yeah. Is there also denial when that occurs?
Denial of the of your diagnosis? I'm sorry?
Yeah.
There can
denial of cognitive decline.
There can be, yeah, self-denial. Yeah, it's such a hard, it's such a difficult diagnosis to face. And part of it, you probably looked up my papers, and I talk a lot about the stigma of dementia, because it's so dangerous, and it's heartbreaking, because we as humans tend to relate our memory with ourselves. And we think that when our memory is gone, we are gone. Or, grandma, grandpa, they're gone. They don't remember anything. But they actually do. They really do. Because there's so many different types of memory. And for example, what we call implicit memory. So riding a bike, walking, brushing your teeth. These tend to be the last things to go. These are all types of memory, and persons with dementia still do these things. And emotional memory is one of the most, I shouldn't say the most powerful forms of memory, but it's so powerful. And, persons with dementia or any type of dementia, they will typically remember how they feel, or how someone made them feel, but they might not be able to explain why. And that can be so confusing for family members. But because they are often so misunderstood or kind of discounted, that increases their loneliness. And loneliness independently will actually accelerate their cognitive decline. Again, so we're seeing all these negative feedback, vicious cycles, rather, with loneliness. And I think once we understand that even when a person starts having memory issues, they are still a person and they still can remember things. And if you haven't seen Alive Inside or that YouTube video with Lady Gaga and Tony Bennett, it is so powerful. So again, musical memory is one of the the brain areas that process music are preferentially spared during cognitive decline. So music memory is so powerful. I went on a tangent there. I apologize.
No. It's totally fine. I was doing volunteer work in my grandma's assisted living in their dementia area, and there was a woman who used to be a pianist, and she couldn't speak anymore. But if you put music on, she would move her fingers and could still essentially play piano.
Oh,
so yeah,
amazing.
Yeah, that was really, really rewarding volunteer work.
Oh my gosh, I bet.
I appreciate how much you put into dementia and dementia work.
Thank you for saying that. Well, and that speaks to what you did, is intergenerational care, right? That's what's so. I wish more people would do those kind of volunteer things, because it's so appreciated reciprocally on both sides.
Yeah, it's.
Oh, thank you for doing that.
Yeah, it's. I'm grateful to my grandma for, throughout my life, she's been there for me, and it doesn't feel like a choice for me. It's a pleasure to be with her. Yeah.
I love that.
Yeah. I could go on about that for a long time. So I want to jump to the other side of the lifespan and ask about brain development and loneliness. So when children are growing up in lonely environments, how does it impact brain development?
Oh my goodness. It's unfortunately, it's very impactful. So if you have ever heard of the experiments with the monkeys, he took them from their mothers and gave two fake moms, right? So one was a wire outline of a monkey and another one had a little bit of felt cloth. And of course, inevitably, the baby monkeys always went to the mother with the felt cloth, the soft one, even when the wire mom had all of the food, right? They'd go get the food and then go back to the other mom. And it caused, as you can imagine, a lot of behavioral disruption. There are also, unfortunately, natural studies or observational studies that we've seen when kids were socially isolated from their parents when they were babies. And it definitely impacts their brain development, but also as a result, their behavioral maturity. And it's traumatic. It's absolutely traumatic for them. And social connection can help reverse some of the effects over time, but it's absolutely a form of trauma for these kiddos, and it takes a long time to undo it.
Thank you for that insight. Yeah, when we look at kind of maltreatment in childhood, I think abuse tends to get more attention than neglect, and I think neglect can really be incredibly traumatic on children.
Incredibly traumatic, yes, I agree.
Yeah. Okay. What can we learn from studying loneliness, and are there silver linings that we can take out from studying something that's not so happy?
Well, and I'm glad you said that, because a lot of times in psychology, we study things that aren't so happy, but we study them so that we can help. And I think the only way for us to help is to first understand it. And that includes any psychopathology under the sun. Loneliness is not a psychopathology per se, but it is a pervasive kind of symptom or construct that co-occurs with so many different types of psychological disorders. So I think the silver lining is that once we understand it, we can take steps to improve it, not only in ourselves, but for others, whether it's in our everyday lives for other people, whether it's for our families, or whether you can actually go to, more structural levels like healthcare systems and even government policy.
That brings me perfectly to my next question. So what can be done at these different levels, individuals, communities, schools, workplaces, nationally and globally, to address loneliness?
Well, we'll start at the individual. I think individually we can develop more relational skills, more social skills, and seek consistent engagement, even when it's difficult. At the community level, we can create shared spaces and, rituals for meetups. In schools and workplaces, we talked about, for example, even in online learning. I think it's really important to foster belonging, not just productivity, right? Foster those opportunities for connection in the classroom. In healthcare, and I'm biased, but it's really important to start screening and recognizing loneliness in patients and responding to their social needs. And at the national level, I think you mentioned, I think we need to start investing in social infrastructures, public messaging, for example, as well. Because trying to build resilience to loneliness comes both from inner sources and broader outer structures.
Thank you. I was just going to ask about how to build resilience to loneliness. So thank you.
Of course.
Just answered that question. So to close out, just practically, for listeners who are struggling with loneliness right now, what practical advice do you have for them? What are steps that they could take to address this feeling today or in the very near future?
I would say baby steps. Do one thing, just one small thing today. Text, or even better, call one person. When you're out and about, make eye contact and say hello. When you're working or studying, sit next to someone instead of sitting alone. Pick an event, a recurring event, and attend it. I always think about how we pass each other all the time and say, "Hey, how are you?" and keep walking. I think stop and actually ask, "How are you?" and give the other person a chance to reciprocate. Mm-hmm. Right? 'Cause sometimes we forget to do that. One of my favorite things to suggest is reignite a past hobby or try a new one, particularly one that involves social engagement. And I am absolutely guilty of this. I used to dance Argentine tango, and which, of course, when you dance, you're in a community and dancing with other people. Work gets in the way, and then I miss my social network. So reignite a past hobby or reach out and try a new one. And I think my best advice is that sometimes we need to lean into the discomfort of trying new things, lean into the discomfort of reaching out to others when you're scared, because again, loneliness can distort how we interpret our social world. So these small, consistent actions can help kind of recalibrate that perception.
Thank you. Thank you again so much, Dr. Warren, for joining us for this episode of the Harvard Extension School Psychology Student Club podcast. This episode, we discussed loneliness and the dangers of it. Please join us again for another riveting installment of the Harvard Extension School Psychology Student Club podcast. Thank you.